Hi, I'm Lori. I'm the Water Quality Director with Columbia Riverkeeper. And one of the most commonly asked questions that we get asked is whether or not it's safe to swim in the river. And right now, in light of the current pandemic, that question still comes to us, but people are concerned about COVID-19 and how it could affect the water quality in the Columbia River. So I just wanted to quickly share some answers to some of the frequently asked questions that we've been getting. Hopefully you'll find this helpful. We've been trying to stay up to date with as much of the current science as possible. As you probably know, that science has been changing very rapidly, almost daily. So as of today, here's what we know. The first question is whether or not the virus could be found in drinking water. And according to the CDC, conventional water treatment methods should inactivate the virus. So the treatment methods that are used by most municipalities should take care of the virus and inactivate it. The next question is, could the virus be found in the river, and could I potentially be expose myself to the virus with contact with river water? And much of what we know about this specific coronavirus, the SARS-CoV-2 virus, is based on other similar coronaviruses such as SARS and MERS. So based on the other coronaviruses, we know that they can stay viable at least temporarily in fresh water. But what we don't know is how this particular coronavirus behaves once it's in the environment. So how it degrades, how it behaves when it's exposed to sunlight and varying temperatures and water. So we really need more research on this topic. One of the concerns that has come up is whether or not there are additional concerns if there are spills of raw sewage into the river. And what we know about this virus is that while an infected person sheds most of the virus through the respiratory tract, um, we do find that they shed viral RNA through their stool. So in some infected patients, we're finding high levels of the RNA in their stool. What we don't know is if the virus is still viable after passing through the human digestive tract. So we know that the virus has a outer envelope, and the tests that we use to test it in the stool are PCR tests, and those are really just looking at whether or not the RNA is present and not whether or not the virus is infectious. So while we know the virus is shed through stool, what we don't know is if it is still infectious. That said, sewage could contain other fluids such as, mucus and other things that could carry the virus. What we think is that conventional, wastewater treatment plants that are operating properly should inactivate the virus. So, discharges from wastewater treatment plants should not carry levels of the infectious virus. However, if we do know that on the Columbia River, there are occasions where we have sewer overflows or leaking septic tanks and leaking sewage pipes, and cases where raw or undertreated sewage is discharged in the Columbia River. And in those cases, as I said, we still need more research to understand if there are levels of the virus, in that untreated sewage that could be potentially dangerous to human health. However, that said, we know that raw sewage contains high levels, or can contain high levels of many other harmful pathogens. So if there's a discharge of raw sewage into the Columbia River, then COVID-19 or the coronavirus would be just one of many other potential concerns that you would be worried about. So whether or not, whatever we ultimately find out about how this particular virus behaves in the environment and how it responds to different treatment and water quality treatment techniques, we still know if there's raw sewage, there's going to be other concerns in the river and other pathogens. So, and then another question we have gotten is whether or not the testing that Columbia Riverkeeper does could test for the virus in the river. And we monitor for E. coli bacteria in the Columbia River, and that is a fecal indicator. So if we find E. coli in the river, then we know that there's fecal contamination in the river. And so while it doesn't test specifically for this virus, it is an indicator that if we find E. coli in the river, there are likely other pathogens in the river that are associated with raw or undertreated sewage in the river. So there would be other concerns beyond just the COVID-19. Another question that has come up is some people have heard about sewage surveillance and wondering what that is. And there are some studies, particularly one out of the Netherlands, that have looked at the influent to wastewater treatment plants and have been able to detect the virus in that sewage. And so what these studies are starting to show is that sewage surveillance might be a helpful complement to health surveillance. So, testing of potentially infected individuals. The sewage surveillance could be a nice complement to that. And in the Dutch study, they actually were able to detect the SARS-CoV-2 in the sewage in 2 communities before it was detected in the population through health surveillance. So, there's some interesting potential for some early indicators or using sewage surveillance as a tool to assess and help understand virus circulation within the community.